And welcome back to today's checklist. Whenever you feel sick or maybe even get hurt, the question inevitably pops up. Should you call your doctor? Should you visit an urgent care? Or should you maybe even go to the emergency room? It can be a stressful decision, so we brought in the expert to help us. NBC News medical contributor Dr. John Torres. He is going to guide us. This is a great idea, by the way.
It can be an expensive decision, too, if you go to the wrong place.
So let's just start with, if you're not feeling well, if you don't feel like yourself, how do you decide whether you should actually call your doctor and make an appointment?
So one of the first things to realize is your doctor, your primary care doctor, is just for that. For primary care, they're the ones that look at you over your life and make sure everything's going okay. So those preventative things, the tests you need, the screening exams, things like that. Any long-term issues, you want to go to your primary care doctor. If it's ongoing pain, it just happens to flare up and you can last a couple of days, go see them as well, because they have been treating you for a while. They can continue that treatment. Persistent cough, these are not things that come up, but these are chronic things. Go to them as well. And in vaccinations, and we'll talk about that in a little bit, but some vaccinations there, some vaccinations possibly at the pharmacy, but you want to make sure they know about all the vaccinations that you've gotten anywhere.
Okay.
I think this next one is good. We're talking about maybe urgent care versus the emergency room. Let's talk about urgent care first. What can they handle?
So one of the big things is if you sprain something, you hurt something, you injure something, but you think it can last more than a day. You're just hobbling around a little bit. You're not quite sure whether it's something you really need to be seen for or not, and then a day later you're like, okay, it hurts enough. That's where you go to them for. So sprains and things like that.
Because can they do x-rays?
Yes, most urgent cares can do x-rays. Or they can send you somewhere to get an x-ray, but they can take care of you more likely faster than your regular doctor can take care of you in some things. Minor infections, if you have things like a sore throat, things like that, urgent care is good for that. If it's a shallow cut, the bleeding's controlled, you're worried about it, worried about infection or closing it up, go to them as well. And low-grade fevers, anything under 104, you can go to urgent cares and be seen by them to see what it is. And, of course, again, that sore throat. Strep throat, I always tell people, urgent care is a great place.
They can swab it,
They can swab you. They can test you right there, get you information, get you the antibiotics, the things you need.
Okay.
So, Dr. John, let's move it up to the ER. What do we need to worry about there?
And so, Al, the main thing with the ER, I tell people all the time, there's a couple things. If it's going to involve life, limb, or eyesight, you want to go to the emergency room. If it needs care in less than 24 hours, you want to go to the emergency room. So things like broken bones, severe bleeding that simply won't stop, or big gaping wounds, you want to go there. Definitely if you have any chest pain or trouble breathing, because it could be a heart attack, it could be some other issue, you want to take care of that. And like I mentioned, 104 is sort of the cutoff for going to the emergency room, because that indicates a severe fever, which indicates a severe infection. You want to be seen there. And then if you can't keep down fluids in particular, food I don't care so much about, but fluids, because you'll get dehydrated very quickly, you want to go to the emergency room as well, because they can rehydrate you and figure out why that is being such a big problem.
All right.
All right, you mentioned quickly about vaccinations, but let's get into it in more detail. My kids all need the flu shot. Do they need to go to their primary care? Or
and, for flu shots, they can go to either one.
Okay.
Because those shots that are annual, flu, COVID, even things like RSV, you can certainly go to your pharmacy. That tends to be a little more convenient, and you can go there. Obviously, you need to look at your co-pays, your insurance, and see what's covered and what's not covered. Especially now, it can be very confusing. For the ones that are routine, like Tdap, the tetanus shot, you get every 10 years, the tetanus, diphtheria, and pertussis, pneumococcal, shingles, travel vaccines in particular, they're going to have them more at your primary care than the pharmacy. The big key here, though, is if you do go to the pharmacy and get them, make sure somehow that information gets to your primary care doctor. Extremely important.
Okay. This is great, Dr. John. Thank you so much.
Thank you.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC, or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.